Hello everybody, my name is Bella Septiani Dias. I will answer this question from case 17 and title is Informed Consent. Before I answer this question, I will read this case.
Case 17. Informed consent. Mr. S, a 56-year-old male, consulted his family physician due to respiratory problem. After X-ray revealed patchy infiltration of the lung, Mr. S was referred to a respiratory specialist, who determined that the condition was bilateral and recommended an open lung biopsy, which Mr. S refused to undergo. After Mr. S' condition further deteriorated, Dr. D, an internist specializing in respiratory disease. Dr. D observed that Mr. S was exceptionally anxious upon examination. The doctor's initial diagnosis was progressive pulmonary fibrosis of the interstitial pneumonitis type, probably involving fibrinolysis. A biopsy was required to confirm this diagnosis, but Mr. S continued to refuse to undergo an open lung biopsy. Dr. D then suggests an alternative procedure known as a drap-in lung biopsy. This procedure was inferior to the open lung method, but in view of Mr. S' refuse to undergo the open lung biopsy, it was an appropriate alternative. Dr. D explained to Mr. S that the procedure involved administering a local anesthetic and then inserting a special needle into the lung while the patient sat on the edge of his bed. He also told the patient the needle would be attached to a drill. Dr. D then outlined the procedure, advising Mr. S that the procedure was usually virtually painless, but did have two possible complications. Dr. D didn't mention to Mr. S that the procedure also involved risk of perforating the spleen or the liver, an uncommon risk, but not as uncommon as death. Apparently, Dr. D was not aware of the risk. Mr. S consent in writing to the drap-in biopsy procedure. Prior to the procedure, Mr. S was anxious, apprehensive, and nervous. He told Dr. he could not afford to die. He was given atropine and sedated with normal and accepted use of morphine. Once Mr. S had been sedated, Dr. D gave him instruction and demonstrated the equipment to him. After a local anesthetic was administered, the operating began. At critical juncture, Mr. S was directed to hold his breath. Instead, Mr. S winced and moved, causing his spleen to be perforated. Dr. D told Mr. S that the required tissue sample had not been obtained, but did not yet disclose that the spleen what he had obtained from the biopsy, he answered something else. His sound became painful, obvious that Mr. S. plain had ruptured and had to be surgically removed.
Question of this case is, should the doctor have acted differently with respect to the explanation he gave to Mr. S? Before that, I will inform to you about what is informed consent. Informed consent is a process in which a healthcare provider educate a patient about the risks, benefits, and alternatives of a given procedure or intervention. The patient must be competent to make a voluntary decision about whether to undergo the said procedure. How is informed consent important to the patient? In a healthcare setting, informed consent allows you to participate in your own medical care. It enables you to decide which treatment you do or not want to receive. Also, informed consent allows you to make decisions with your healthcare provider. But wrong question in case 2017 is yes. Doctor must perform different acts on patient Mr. S because Mr. S has anxiety control disorder. If Mr. S anxiety is out of control, it is dangerous and lead to failure of operation in the respiratory tract of patient. Mr. S and Dr. D should be a more psychological approach to patient with help in controlling anxiety.